Right, we are joined this evening by Sarah from Breadline, and you might recognise Sarah because she joined us for a prayer evening a while ago to share about Emanuel Clinic in Moldova. Tonight she's going to be sharing about a branch of Emanuel Clinic, which is called the Home Care Project, who provide palliative care to those in Moldova. So Sarah, thank you so much for being able to join us this evening, and over to you. Are you okay to unmute? Sorry, Sarah. Oh, Sarah, can you hear me? Sorry. Oh, there we go.
Is that working now?
Yeah, that's perfect. Thank you.
Okay, fantastic. Firstly, just thank you very much for inviting me back. No, it's great being with you guys and just people who've got a heart for the gospel and just for sharing, God's love through medical terms and through medical ways. So I say I work for Breadline. Um, Quickly, we were founded in 1995 with a vision just to support our partners, working alongside local churches and indigenous groups within Eastern Europe, particularly Moldova, to share the gospel with them and to empower the local people to share the gospel of Jesus Christ. Um, for those of you who don't know, Moldova is a tiny little country in Eastern Europe, bordering on to Ukraine, so like landlocked between Ukraine and Romania. It's just had a general election, which for us has been a great answer to prayer. You may remember at the last prayer session, I asked for people if they could pray for the election in Moldova because there's lots of political interference between like Russia and whether Moldova would want to head over towards Russia or to join the EU. And thankfully, we give thanks to God that they voted to go along with joining the European Union and keeping in like a leader that has got a passion for the people. Okay, so Breadline as a whole, we don't just work medically. We work with social action projects, social enterprise. We train pastors and ministers to go out into the communities to share the gospel. We do quite a lot with disability care, different groups within the community to support those with special needs, of which there's very little in Moldova. There's also a disability centre in Stresien that we're supporting to create a huge centre for people with disabilities so that they can have a quality of life. We also have a lot of village ministries supporting pastors working in rural communities, including the medical costs of the pastors that are out there. We support a refugee centre and various education projects. This here is just one of the examples. Little things that can make a huge difference in the lives of communities and people. Yeah, it's a good old faithful ping pong table. Might not be that much, but that ping pong table, which we're able to fund for this community, brought in a whole host of young people in a community that had nothing. And just to be able to see them be mentored and trained and starting to reach people themselves within their own school communities has been such a huge blessing, which started off from a ping pong table. We also do a lot of pastors training groups. This group here training are actually training towards the Christmas outreaches. And one of our pastors who's heavily involved with lots of shoebox campaigns brought the pastors together to say how we're getting these shoeboxes, how can we share the gospel with the people as we give the shoeboxes out? So fantastic ministries and enthusiasm to share the gospel within Moldova. So we also do a lot of social enterprise, setting up businesses. One of the issues that Moldova's facing is a huge amount of their young people and working people who are able to work are actually leaving the country to go to Italy, to go to Britain, to any country that pays more than what Moldova does. So one of our hearts is to create ways of those people having jobs and a future within their own country. You see that the little pictures of a Christmas tree, cheese gifts, and what's being prepared to be sold. And then once they sell these gifts, that then gets invested back into the community, into outreach and evangelism. And the ladies who are creating bread in the bakery, they sell it in the community, which raises them money, but they also use it to give away in the community to help people that are in need. This here is a church outreach back in July, the two pictures on the left, which was, they went into a village, one of our church partners, in the morning, did like some kids outreach games. In the evening, they had an event. They had 60 people came forward to give their lives to Jesus. Not 60 people have been coming into a church, but they've got about 20 people who are consistently, 3 months later, being discipled as a result of that outreach. So these are all projects we support. This is another family that's been receiving support through Breadline. The local council actually approached the church and they said that these children were going to get taken off this mother who's a single mother, and she didn't have any income, she didn't have any support, and the father of the children was an alcoholic who was abusive. The church said, no, could they support them? So the church that we partnered with supported this young family. The girl on the left on the photograph is called Daniela. She kind of brought up her younger brothers. We've also got an education project which looks at putting young people through education, get them qualified to do various jobs. So if you look at the girl on the left, and now look at the teacher in the middle. That girl on the left graduated as a teacher last August, and she's now teaching in one of the local schools and helping young people out, thanks to the church. But more importantly, she knows Jesus and she loves Jesus, and she's so thankful to people who have supported her in that role. Okay, and then obviously Emanuel Clinic is particularly what I'm here to talk to today, to do an amazing work for Jesus. Their vision is to share the message of the gospel of Jesus Christ through medical services to the suffering people based on Christian principles, compassion, sacrifice, respect, and love. They do so much within the community. The lady who runs it, she also runs the women's ministry of the Baptist Church, hugely busy, but yet so passionate to reach the community for Jesus. And they've done that through medical means. In the main clinic, it's quite a big clinic. They've got lots of different doctors. So it isn't just a one doctor person, one like small group, but they've got lots of different areas from pediatrics to gynecology, neurology, ophthalmology, endocrinology, orthopedics, cardiology, every department that you'd have in a standard hospital in the UK, they're also doing that within the hospital there, which is fantastic because they've got that expertise and partnering with people to make sure that that goes into the community, and those who are poor, who would not otherwise be able to afford treatments, can get those type of treatments. One of their new projects this year has been healthcare for families with many children, but they've got a heart just to bring in more support to big families because of the amount of people who are emigrating. Sadly, those people are not necessarily taking their children with them. So children are then left with a sister or with a parent and become quite big families, and the money doesn't quite get sent home as it was promised. So Emanuel Clinic are looking at getting the healthcare for families there to support those with big families who wouldn't necessarily be able to afford that care. They're also very, very passionate about what they call the medical spiritual education. This project is all set up about not just taking the gospel to individual patients. You know, if one nurse can reach 20 or 30 people with the gospel of Jesus over a month of seeing different clients, imagine what would happen if all the nurses in the community were Christian. If all the nurses in the community had that passion to share Jesus with those around them. So the clinic have set up lots of different projects and lots of different ways that they can reach the nurses and the doctors within Moldova for Jesus, through bringing in Christian professionals from overseas that are well respected within their medical disciplines to come and speak, but also to share the gospel. And it's just seeing so many people, so many nurses, doctors actually coming to faith and then being able to be a witness to other people. They're also doing a lot with with students in the medical areas, with student nurses, student doctors, running student camps for them, just so that they can grow in faith, but also know that as a doctor and a nurse, there's ways of sharing that love of Jesus with those that come into contact with. They're doing a lot with the Ukrainian refugees. In a country of 2.5 million, they did have 875,000 refugees through the country. There's currently 120,000 in the country, which is still a huge amount for a population of 2.5 million. And every month, the clinic, or every day, Sister Eugenia reckons they get about two new refugees coming in who are desperate for support with the medical treatment. So they're looking for more support with the Ukrainian refugees. Okay, food packages. Obviously, one of the problems, you know, those who've been in medical areas will know that if you're reaching people, you know, with health needs and they don't have a good diet and they're going hungry, then they're not going to recover the best way that they can. So alongside providing the medical care, what they're finding is they're going to have to feed people nutritious food as well as just the medical medications that they need. And they're also bringing in charity days, which is a new thing this year, which is just for the most vulnerable within the communities, and getting people who they've identified through local pastors to come in so that they can have treatment early on in the conditions rather than leave things for much later, so that they don't make a recovery or the illnesses are progressed too far. Okay, now the mobile clinics are something which they're hugely grateful to the medical missionary news for. You know, pre-COVID, they were maybe doing, you know, 16 to 20 clinics a year. Last year, they did 38 clinics. So far this year, they've completed 32 clinics and they've already got 16 booked in for next year, which is absolutely amazing because these clinics go into rural communities where there isn't a doctor, where there isn't access to any health services at all. But not only do the doctors and the nurses go in, but they work with the churches and they have the outreach team and the evangelism teams, so that it's not just about the physical health, but it's about the spiritual health of people. And it's a way of the gospel being shared with partnership with the local churches, which is just so crucial in the work that they're doing. And then the home visits, which I have been absolutely blown away with. Just you think about somebody who's elderly, somebody who's bedbound or suffered a stroke, and they're just stuck at home with nobody. And for so many people within Moldova, it really is that they're at home with nobody. You know, I think that when I was over there and we visited some of the elderly people, we were the only people who they were going to see until the next time that the church was visiting them, or the home visit team was visiting them. For elderly people whose children have gone to the West, into more affluent countries to work, cost of living crisis is rising over here, which means people don't have the money to send back home. When we were there visiting, there was one lady that we were visiting, and she had a daughter in Germany. This daughter in Germany was doing everything she could for her mum. That was paying for a home help or a cleaner to go in to help her mum twice a week. But what this lady didn't quite realise is how poorly her mum was. This cleaner was having to take care of her mum's basic needs. She had no medical training. She had no knowledge of pain relief. She had no knowledge of anything. Since we were there, Eugenia's managed to set up a home visit to go into this lady, and just to be able to give her some comfort and some pain relief, somebody that knows how to change the dressings, so that she's getting sterile dressings put onto her wounds because the infections were getting really bad. Before the home visit team had gone in, she was at the point where they were thinking she might be losing her leg because she had such a bad infection, because there'd been no sterile treatment. Because this young lady that was going in was wonderful. She was so caring, but she hadn't had any training, and she didn't know what she was doing in dealing with people. Another story we keep getting told by people is just the desperation of family who are there when you're looking after somebody who's so poorly and you don't know what you're doing, you've got no relief, and it's 24/7. And the home visit teams have just been able to go into those situations and to be able to be a support for family. They've got 2 full-time pastoral workers who are employed, not for the medical side, but for the spiritual care and just for counselling of families. They've been able to go into these situations and see from the photograph there, just provide beds for people. My dad was recently in hospital. Sadly, he did pass away, but the palliative care team in the hospital, they were amazing. Before he was even allowed to go home, they had to make sure he had a bed, that there was carers in place, that there was going to be pain relief. But yet, these beautiful people in Moldova, so needy, they might be sleeping on the floor because they can't, the beds, the mattresses have got so badly soaked due to bodily fluids and that type of thing, so they can no longer sleep on the beds, so they're sleeping on the floors. That's uncomfortable for the best of us, never mind those who are suffering and in pain. It's just absolutely heartbreaking just when you think about the amount that we have got over here, and then you just see the need of some of the people, and yet that little bit of love is causing so much impact in those lives. That when Emanuel Clinic are taking the home visit teams in, it's one of the ladies that Sister Eugenia was telling me about. She didn't eat between the home visit teams going in because she'd lost her dexterity and she wasn't able to actually feed herself. So this poor lady, who was very close to death, but not able to feed herself, not able to look after herself or anything. And it was only 3 times a week that the people were going in when she actually had a proper meal. She was cleaned, changed, and made to feel comfortable and given a pain relief. And they're doing an absolute amazing role, an amazing work with the people who are going in. But the problem is there's just so many people that are reaching out to Emanuel Clinic and saying, please, we need your help, we need your support. And they don't have currently the resources to do all the houses that they need. And as one of the nurses, said to my colleague when he was over a couple of weeks ago, but lots of these people need a much more intensive care than what they're getting. 3 visits a week isn't enough. I think of my dad, when the care that he was offered, he had Sorry. So like my dad had 4 visits a day with the carers. He had a palliative care nurse going in. He had the Marie Curie nurse going in. He had another nurse from a hospice going in and doctors on call. Whereas these people have got nothing, just 3 visits a week. And I think the disparity within that is absolutely crazy and heartbreaking. So there's a huge need there just for more investment in the area because they need a proper palliative care packages to be implemented within, within those homes, for those ladies and those, beautiful men. So many of them have worked so hard all their lives, but yet they've come into the end of a life and they've got nobody, for just bedbound and not able to care for themselves or have any pain relief. I think of just a few stories from the team. One gentleman that the team had been out to visit and they'd found him, he was dead. But it wasn't just that he died before they'd gone in, but they think that this gentleman had been dead for 4 or 5 days and he'd been close to death. He was a poorly man, but yet, there was no other support except for the team going in. And you just think they're dying alone in such pain and such lack of care. I think of Anna with no family, no support, the lady that I just mentioned. Plastic bags for catheters seem quite common. Instead of like proper catheter bags, wound dressings. When you hear of people that are suffering, but yet there's so much extra pain because they haven't got suitable dressings to go onto their wounds. One of the things the nurses did actually ask Stuart when he was over a couple of weeks ago was just to thank people who have sent wound dressings over because they've made such a huge difference to the work that they're doing. And without them, people would be getting much more infections and suffering much more. And they've said some of the dressings that I think you've organised for them to go over, they've said have been absolutely miraculous. It's just like the wounds have disappeared when they've put them on. It's been nothing like the bandages that they've used previously. So a huge thank you to those who have sent those out that have given people some relief towards the end of their lives. There's so many stories from the nurses of people not being able to eat between visits, not just because they don't have food, but just because they don't have that dexterity in their arms to feed themselves. And again, just a pain relief. I think of my dad in his last days, the amount of pain that he was in, and just being able to make a telephone call to the doctor or to the nurse who would then come out and alter his morphine kind of regulator so that his pain would go. And then I think about some of the ladies, some of the men that are suffering and have only got paracetamols that are maybe only administered 3 or 4 times a week, when the amount of pain they're in, it doesn't bear thinking about. So please just keep this team, in your prayers. And equally, I just ask you to keep the whole of the work in Moldova that Breadline are involved with within your prayers. God's doing such amazing things over there. And I do have some different prayer points, particularly praying for peace in Ukraine at the moment. The country needs lots of stabilization, lots of fear that's coming out from people again. And especially as well, if you could just pray for more affordable medications and equipment, and for each person in Moldova to have that dignity in death via palliative care, that people can feel in those end days that they are being cared for and that there is a God who loves them and they haven't just been left like an animal on the side and that's it. But those last days can be a really precious time for families and for people. And equally as well, one thing I'd really ask everybody to pray for is for discipleship of the people. You know, the nurses, when they go in, they're seeing people come to faith. The spiritual counsellors are seeing people come to faith. When we have the outreaches in the villages, people are coming to faith. But faith's so much more than just that decision to follow Jesus. You know, we want discipleship of these people. We want people to really engage with the gospel and to really have that knowledge of Jesus Christ as their Lord and Saviour, and to know what that means. So please, if people could just continue to pray, you know, for that, and for the people that are experiencing the home care and the palliative care, that they will have that peace, that they're not, you know, that they're not alone, but there's a God there that cares for them. So that's my main kind of prayer points, and I really value everybody's prayers towards that. Be so much appreciated, and just thank you again for allowing me to come this evening and to share with you. It's much appreciated, and I know that your prayers make a huge difference to the work that we do, and there's so many other missions partners that you guys support. So just really, really thankful. Thank you so much.
Thank you so much, Sarah. That was incredible. So thank you for sharing what you have. I know that you said that you were happy to open up to if people did have any questions about the project. So if you're happy to do that now, I don't know if anyone does have any questions about Emanuel Clinic or specifically the home care project that they would like to ask Sarah that's not been covered tonight.
Sarah, I was just wondering, we were wondering about the age of the girl whom you showed as the teacher. The young girl was looking after the family, and then that lovely picture of her in a classroom. What age was she then?
When she was young, she was 8 years old, when she was brought on to be like the church's attention, and the pastor had gone in to support the family. She's now 20 years old, which seems very young for a teacher from our side, but at 16 is when their education finishes, and then they either end up, she'd have probably ended up in the sex industry if there hadn't been another route for her. But through the education project from 16, she went on to do her further education in the local town.
Thanks.
But beautiful soul, and so passionate for Jesus now. In fact, she said the first salary she wanted to pay towards the church, and she gave all of her first salary into the church, but as a thank you for everything that the church had done for her and her family, which was just so touching.
It's lovely seeing a story like that all the way through as well. The church have been supporting them for that long. It's lovely to see that. Are there any other questions for Sarah at all that anyone has?
Let me ask one then. What will people think? So, Sarah, can you just tell us a little bit about the home care team as such? How many people is it? I know you said, I think there's a couple, and they do 3 visits. How many kind of homes do they go into? Can you just kind of give us a little bit of a flavour of that?
Yeah, so the team itself, they've got 8 full-time kind of carers that go out, and they've also got 2 pastoral carers, which are like provide the spiritual care and support for the people. I'm not certain of the exact numbers that they go to each week, but I know they tend to do between 4 and 5 people a day for each pair when they're going out, which might not seem a lot, but I guess it's like 2 hours per person when they go in to visit into the different communities. But they'd love it to be more.
How is it that you identify these people, Sarah? And the people in need, how can you identify them?
Most of the people have been identified through local pastors and through the church communities. So Sister Eugenia works very closely with the church communities, but there's also referrals coming in from the equivalent of their social services, because there isn't any care in the community. So if the council their equivalent of social services, which is nothing like what we have as social services with that in-depth care, sometimes approach them to say, what can you do for this family? There's nobody else to help them.
Is there any difference between the towns and cities and, I gather, the more rural parts?
Lots of difference. The rural parts are very much becoming a very elderly and a very dead kind of community. As young people are moving away from the rural parts towards the cities and then towards the west. So if you go into some of the villages in Moldova, you'll find a population of people over 75 and young children. And then there's that big bit in the middle where there's nobody at all, which leads in lots of poverty, lots of homes that they can't maintain because
they can't do it.
Jobs, yeah, and it just becomes much harder. You know, there isn't money in agriculture, so people don't stay around for that, which is partly why we're trying to do the different like business projects within the communities, just to support those communities. Because you go into a village and you'd expect it to be thriving and moving on as to how it was, you know, 10 years ago. When we went out in April, one of the people who we went with had been out like 12, 13 years before. And he says one of the things that amazed him was in Chisinau, in the capital, was how advanced things were from the time previously. But yet when you went into the rural villages, it's like it had gone back in time rather than going forward.
Thank you.
Sarah, could I ask, can you buy things like sterile dressings locally? The question behind that is it better to send money gifts or gifts of things like dressings?
I don't know if I can buy them locally because they don't seem to, the ones that have been sent from here, I'm not medical minded, so I can't explain it, but they say there's like a gel in them, but they can't get over in Moldova. And they say that those, what come from here, they can't get it. Equally, there are a lot of medications that they can get there because we can't send in the actual tablets and medications. But things like the dressings, the catheter bags, there seems to be a huge shortage of. So even when they've got the money for catheter bags, they don't seem to be able to like source them.
I mean, just to add to that one, I mean, we buy the dressings from a supplier here, so they are specific ones that have been requested by the team that they can't source locally. So if you're wanting to support that, then obviously that can be arranged because we've got ways of sending it out to them. Alternatively, any dressings will be a benefit because obviously the need is, they're not so prevalent there as they are here. So yeah, there's different ways that we can help depending on what people are able to do.
Yeah, the nurses say we're just miracle workers. We say it's like the whole like injury or the whole, you know, like wound just seems to heal in front of their eyes with the dressings that you send them.
Great, thank you. I will end the recording if that's okay.